voice, but I won't. I will behave and use the proper technology. Welcome everyone to Adult Social Care Committee number 3, 2nd of December 2024. So, thank you all for coming. We are quorate, even though all of the councillors members are not currently here. Councillor Y, I believe, is going to be running late, so he should turn up, and I'm hopeful that Councillor Weston will turn up as well, but we'll get round to that. Okay, so agenda item 1, we just need to welcome everybody, and if everybody would like to introduce themselves, and if we start to my left and we work our way round, that would be perfect. Thank you.
Hello everyone, my name's Bronwyn Falconer. I'm the Policy Committee Officer supporting adult social care.
Try the next one. Just try the next one.
Carol Johnson, Councillor for Hallfield Ward. Thank you.
Councillor Joss Clark, Brislington West.
Don't worry. Can we, if we go over to the front row.
Yeah, Emily Wren from the Keeping Bristol Safe Partnership.
Helen Pitches from Adult Social Care.
Councillor Mohammed Makawi, Cotton Ward.
Councillor Martin, Labour Councillor for Froome Vale.
I'm Kelvin Blake, I'm Councillor for Hillfields.
Mehdi Jacobson, Director Adult Social Care.
Mark Weston, Councillor for Henbury and Brentry.
And I'm Hugh Evans, and I'm Exec Director for Adults and Communities, and I don't need a microphone.
Have you not got one? Oh, he's not got a mic.
I don't mind. I can project, unlike Mark. Unlike Mark, I can boom.
We can both have one. We can share this one probably. I would have
That's
thought.
right. Yeah, we'll move it when we get it. That'll be fine. I get.
Oh, that's me then.
Are we being webcast?
We are.
Okay, we'll just make sure we speak into them when. Thanks, Councillor Clark. That's good tip.
I just asked for clarification on that and still forgot to mention it. So just for everyone's awareness, we are now recording all committee meetings now. Sorry, apologies for not saying that right at the very beginning, so everybody is aware. Okay, so, and I'm Lorraine Francis, Chair of Adult Social Care. So let's just run through the emergency evacuation process. In the event of the fire alarm sounding, please leave the room calmly, it says, via the lobby area, so no panicking. And through the main door, turn right and walk down the road toward the cathedral. And we will be taking a 5-minute recess on the hour for 5 minutes. Okay, so apologies for absences and substitutions. So
Chair, can I think we need to, there's no other committee, full council, we don't do this, have a 5-minute comfort break every hour. And just let me finish. If people need to go out and get a glass of water or use the facilities, then surely they can just pop out rather than us having a break, because it just elongates a meeting still further. Just wonder what other people think.
With respect, Councillor, there is a reason why we are doing this. If you want to have a conversation with me outside of the room, then fair enough. But it is a chair's prerogative also to do that, as opposed to, it's not a negative thing. Members do not have to leave the chamber. So I would ask everyone to come back promptly when we have that 5-minute break. Okay, thank you. Okay, so let's just, agenda item 2 is apologies for absence and any substitution. So as of today, we have one apology from, he's going to kick me, Councillor Callistone. He's not going to be here. And I understand that Councillor Y is running late, but will be in attendance. I don't think there's anything, no more apologies, obviously. Okay, we're quorate, as I said earlier. So agenda item number 3, any declarations of interest, Councillor?
Thank you, Chair. In item 7, I'm currently the chair of Second Step, and the Second Step are the delivery partners for Changing Futures. So I think it's probably best that I step out for that item, which is what I'm going to do. Thanks.
Thank you. Okay, so agenda item 4, minutes of the last meeting. Can I ask if any members have anything they wanted to clarify in regards to the minutes? If not, okay. So we can confirm that the minutes are correct.
So we do need those to be seconded.
Oh, we'll keep forgetting that. Thank you, Bronwyn. Can I have a seconder? Thank you, Councillor Blake. Okay. Agenda item number 5. I do have a feeling that we are going to finish really quickly today, so I'm going to just try and slow down, not to talk too fast, but we don't have a heavy agenda today. Okay, so announcements from me. I mean, the only thing really today is that after this session, we will have a members' briefing on the Care Quality Commission inspection. Immediately after this meeting, and if we did for any reason finish earlier than we expect, which is 4, we're predicting, would members be happy to just have a quick breather and then we head straight into that meeting? Yeah, thank you, that'd be great. Excellent. Okay, so agenda item number 6 is public forum. We do not have any questions or comments from the public. Agenda item 7. Okay, so we're going to move straight into our first agenda item, which is addressing, thank you, Kelvin, addressing multiple disadvantages and, sorry, I've forgotten her name. I thought, Helen, sorry. I was sorry, Helen. I have got a real issue with remembering names. So I'd like to introduce Ellen to do her presentation.
Thank you very much. So I'm here to present this committee report to you about the Changing Futures programme in Bristol. So just to give you a very speedy overview of the Changing Futures programme, we applied to the National Lottery and MHCLG in 2021. We were really fortunate as a partnership in Bristol to get £4.1 million of funding at that programme for this multi-agency programme. So Changing Futures is looking to make a difference to people who are experiencing multiple disadvantage. So they are people who are homeless, have substance misuse issues, mental health issues, domestic violence, and in the criminal justice system. So if you're experiencing 3 or more of those, then you're considered to be multiply disadvantaged. And in Bristol, there's about 200 people who are at the most acuitous end of that spectrum. But we've done a needs analysis, and there's probably between 1,500 and sort of 2,000 or 3,000 people in the city who are experiencing 2 or more of those things. So the Changing Futures programme is the lead agency is Second Step. We have been looking at system change priorities to try and ensure that we can change the outcomes for individuals. So we've been looking at the My Team Around Me approach and embedding that, and that's a multi-agency approach, putting the person at the centre of their own kind of care and support, ensuring service continuity, shared accountability between partners. And it's a really client-led and trauma-informed way of working. We've been working with a cohort of individuals, 60 people. They have been groups of young people, groups of people who have been homeless for a very long time, and women who've been experiencing domestic violence. And we've been looking at this through very specific lenses. We've been having the kind of voice of lived experience as part of everything that we do. So they're on the programme board and on the transformation board. It's trauma-informed practice, and there's been an equality, diversity and inclusion lens as well throughout the whole programme. So today the report is looking at, sorry, I'm just trying to flick my slides on. So we're asking the committee to note the work of the programme to date. We've seen some really great success in the programme. People have been supported really well, and we've seen improved outcomes in reduction in homelessness, and particularly in people accessing mental health and substance use services. we're asking that the committee continue to support this partnership approach in Bristol, and that the multiple disadvantage strategy that was ratified about a year ago, which is a Bristol-wide multiple disadvantage strategy, continues and is supported by the Multiple Disadvantage Transformation Board, of which Hugh Evans is agreeing to be the chair as of next year. And the MHCLG and National Lottery are considering whether they fund the programme for a further additional year. And we are relatively confident that we will get some additional funding. So we're asking the committee that if we get that funding, that we can spend it to extend this programme for a further year, while we continue to embed the really kind of valued learning that we've had in this last year. So we're only one of 15 areas in the country that's got Changing Futures money, and as I say, it's been really well regarded because we have our strategy, which really underpins and kind of cements that work. So the sustainability plan for the next year, should we get that money, we're looking to continue to work really closely, because this is embedded in the work of adult social care. There's the Homeless Move On team, which is kind of one of the key partners in the My Team Around Me approach. So we're looking to embed that work and continue to work with those partners. There's some wider system change projects that the learning from those will sit with the partners, so not necessarily in the Changing Futures programme, but the kind of learning and actions from that will sit with those stakeholders. We will continue to work with people with lived experience. They will be on the transformation board and will be at heart of the programme and how we make decisions. As I say, we're looking at the programme board for Changing Futures merging with the Multiple Disadvantage Transformation Board, so that we can, there will be a delivery plan that sits under the strategy, and that again will be led by Hugh and with corporate oversight from the Health and Wellbeing Board. And so that strategy and that delivery plan will outline the key kind of actions that will need to be owned by wider system partners, not just the City Council, because obviously these are people who are touching on health and criminal justice system, etc. And then we're also looking at the kind of resources that we have for, how to do what My Team Around Me, how to work, being housed on the City Council website, and the Adult Social Care Learning and Development team over the next year taking on that kind of understanding of how that works, so they can continue to embed and roll out the training programme that is going to begin early next year. So the timeline for this is that we hope to hear if we got any new funding by mid-January. We've just put in the application to the National Lottery Fund. It says December on there, but I think it'll be mid-January now. And then in January 2025, as I say, the programme board is going to merge with the Multiple Disadvantage Transformation Board, becoming one entity that will take this work forward over the next year. And we will have the plan that will sit underneath the MD strategy that, Hugh will kind of strategically steer. Sorry, nearly hiccup then.
Thanks, Helen. So I'd just like to reiterate to members that this is a key decision, as it involves over 500k, but it is just for our information. We are not funding this project, so to speak. Okay, so let us see if there's any members have got any questions. So I'll have Councillor Weston, Clark, and then Councillor, I've got the wrong glasses on, Louis, Martin, Councillor Martin. Okay, thank you.
Thank you very much, Chair. I've got a few questions, if that's all right. One, going through it, and I realise we're getting external funding to deliver this, so possibly my questions might be superfluous, but what I couldn't see, it talks about having a great deal of success. By what measure do you measure that success? For example, on the slide that appeared earlier, it said you work with criminal justice involvement, young people involved in criminal justice involvement. What are the statistics to show that it's succeeding in stopping the revolving door with criminal justice? I'm just wondering, how do you measure that success, if you could? So
there's a national evaluation of the programme, and so we are in the midst of that, if you see what I mean. So locally, we've seen things like, as I've described, we've seen a reduction in presentation to our homeless prevention services. So we have the numbers of people that we're working with, this small cohort of individuals, and for those individuals we can see, because we're measuring over time where they've been accessing housing or accessing health services, and some self-reporting about whether they're feeling, you know, more confident to, you know, or experiencing, you know, feeling more confident to approach services and feeling that they're able to cope with things, you know, more successfully. So we're kind of measuring their own personal experiences and getting reflections from the teams that are around them. So that, I think in the report, there's a kind of spider diagram that you can see, and you can see from that where things have got better. So the closer it is to the middle, then things are beginning to improve for individuals. But we're also measuring it by, it's being externally evaluated as a way of working.
It's really, sorry, I'm just jumping in a bit, but it's really difficult to actually get any data apart from the spider diagram figure 1 to actually really understand what the numbers we're talking about. It's just a sort of, it's okay, but it's just lacking a bit of data. Can you just explain this a little bit further, please?
I can, yes. So that is the data on the individuals that the programme has been working with. So that's that cohort of 60 people. And so that's showing you the improvement in outcomes for those individuals. So there are 60 people in the programme that we're working very closely with. And so there aren't numbers on there, if you see what I mean. It's not saying that 54 are... Yeah, apologies. So the 0, 1, 2, so that's about... So each spider, each kind of bit of that web, if you see what I mean, everybody who's maybe experiencing homelessness is what we've done is measured at the beginning what their experiences were, and then so that as you go further in, that means things have improved for them. Okay. Yeah.
Okay. So can I just ask that everyone comes through the chair, please? It's protocol, and I would appreciate that. I think Hugh is going to comment on this issue, and then I'll come back to you next. Okay. You carry on. Okay.
Thanks. I mean, it's a moot point, this, because what we've had is the benefit of what you might call a proof of concept phase. So nationally, this resource has been invested over the last few years, 3 to 4 years, in order to prove the concept. And I think that the qualitative information that we've had does prove the concept. It does prove, as we knew anyway, that if you develop a kind of my team around me approach to support the most complex people, that you do get better outcomes for those people. Now, obviously, we're not going to get like in the NHS side of things, you get National Institute of Health and Care Excellence level huge clinical trials that kind of are put into place with control groups and what have you that help you to develop a more strong quantitative hypothesis. That's what the national evaluation is meant to be doing at this stage, and I think it's one of the good reasons why I think people do want to extend it beyond this year in order so they can carry on with that evaluation, because it's obviously complex people, huge and complex systems wrapped around them. So the effect it has on adult social services within a council is one thing. The effect it has on the NHS is another. The effect it has on the Department for Work and Pensions, the effect it has on the criminal justice system elements, all have to be viewed together in order to work out the efficacy or otherwise of this work. We're pretty convinced it is of benefit. It certainly does help. But the big picture proof of concept has yet to be fully established. And, we won't be able to mainstream this kind of work until we have that, because there's such a large amount of resource involved.
Thank you. Councillor Weston.
Yeah, sorry, just another quick basic question. Obviously, it talks about how it's a multi-discipline, multi-team approach. who exactly are the private partners we're working with, or the non-council organisations?
It's likely to be the probation service. It's likely to be voluntary sector and community, services for people who are homeless or with mental health issues. We're working really closely with AWP, which is Avon and Wiltshire Mental Health Partnership. They're very interested in the my team around me way of working. So the concept lead has been training lots of AWP workers. They're calling it your team, your way. So it's this kind of way of working, and they're using it in the mental health partnership too. So it's really beginning to kind of, get out into the wider sector as a way of working. But as Hugh says, it can be a little resource intensive. So it needs to be, it's best used with those people that really, really need it, essentially.
Thank you, Chair.
Councillor Clark.
Thank you. Thank you very much for your report. Really interesting. It's a no-brainer. We want to get that money if we can secure the funding for subsequent years. Absolutely brilliant, because this seems to be a really good. It is labour intensive and it's very expensive, but the outcomes for individuals seem to be really positive, and hopefully we can hold them so that they can really sort their lives out and move forward in a really positive way. The consolidation of the boards, are we convinced that we've got the appropriate oversight and nothing's going to slip through?
We've looked at each area of sort of disadvantage, so we will be asking people from probation. They've already been up there on the programme board, so we'll make sure that we've got representatives from each of those areas. Mental health, our housing colleagues are closely involved too, so yeah, we're looking to make sure that we've got that representation from lived experience and representation from the voluntary sector too.
Brilliant, because it'd be really important for the evaluation, and obviously if this is a programme that we can keep funding for a number of years, obviously it's going to morph and change and develop as we learn through our experience, I'm sure, and through our service users' experience. So thank you.
Thank you. Councillor Martin and then Councillor Y. Thank you.
Thank you, Chair. I also wanted to express thank you for the work you're doing. I think that this is really important for people who are facing multiple disadvantages across the city, and I will be voting to approve this grant. I think it's quite timely as well, because within some of the people we're supporting include victims of domestic abuse, I can see. And at the moment we are observing 16 days of activism against gender violence. And we've had some really good things happen in the city recently. We had Labour's motion to eliminate violence against women and girls a few months ago, and to keep this issue at the top of the agenda for the council. And last week as well, we had a vigil where lots of us came down to College Green to stand in solidarity, and it was really positive in order to take note of the people who are suffering from gender-based violence around the world, and we need to focus on that in Bristol as well. So I feel very privileged to be here and to be able to vote on this today. I'll also say, thinking back to last meeting, I was very disappointed that the Greens voted to reduce funding for preventative services, but I think that was a mistake. But I hope today that there will be a unanimous decision and that we'll all approve this. Thank you.
Okay, so just a point of clarification. That wasn't quite a statement, a question, and we did have at the top of the agenda to comment on the previous minutes where you could have made that statement about this as a committee voting for something or voting against something. It's a committee decision. Usually I say that at the top, and I didn't this time round. But thanks for your points. So, Councillor Y.
Just a bit of historical context, Helen. It doesn't seem, my team around me doesn't seem completely dissimilar to Golden Key. Whatever happened to that? And is this a kind of continuation?
This is Golden Key 2.0, Tim. This is Golden Key in action. So all the learning from Golden Key has fed into this bit of work.
Okay, so that was my next question.
Yes,
there is some continuum from the learning from that. Yeah.
And one of the things we learnt from Golden Key was when it ended, the partnership had swung a bit too strong towards the voluntary sector and not that full partnership between the statutory sector and the voluntary sector. So we've learnt that, and that's why we're looking at ensuring that the board, the transformation board, has that mixture between the kind of statutory partners and the voluntary sector partners, so that the learning continues across all areas, and doesn't just land in the voluntary sector or the statutory sector.
Yeah, it's just kind of that bit about organisational knowledge. So I'm glad it's you, because I know you were around the first time round. So thank you.
Yeah, just very briefly, I think it's worth noting that it was because of a lot. I mean, all the stuff Ellen said notwithstanding, it's because of the learning from Golden Key and the capability that was developed in that era that we won the Changing Futures grant. We won the bid for it in 2020. You know, so or 2021 or whenever it was at the very beginning of the time I was here, and I think the partnership that was developed in that stage, you know, showed a very mature and capable kind of system that was exactly the kind of system they were looking for to take on board this Changing Futures piece. So yeah, 2.0, it's a development on the theme.
Okay, so as we round up this part of the agenda, I'd just like to say, actually, I'm just a little bit disappointed that I'm not really sure. I'm just sort of trying to process what Councillor Martin just said about the Greens cutting preventative services. I'm not really sure what that means, actually. But I'm going to say that, no, we're not, the Greens are not doing anything of the sort. We are part of a committee, and members are all working in the best interest of Bristol. And I think sometimes there will be decisions that come late to the table, and difficult decisions have to be made. So we are all in this together with our £26 million deficit in our budget, with a projection of over 50 million if we do not make sufficient cuts to address the deficit in the budget. So I'm just stressing that. Okay, so for clarity and for the benefit of anybody who may be listening, I ask that the Committee for Adult Social Care do the following. So I'm going to read all four, and hopefully we're just going to say yes or no. So approve the acceptance of the Changing Futures grant from the Ministry of Housing, Communities and Local Government, and or the National Lottery Community Foundation to continue to deliver on the programme stated aim in line with Bristol Multiple Disadvantage Strategy. Point 2, authorises the Executive Director, Adults and Communities, in consultation with the Chair of Adult Social Care Committees, to take all steps required to accept and spend the Changing Futures grant as outlined in the report. Point 3, authorises the Executive Director, Adults and Communities, in consultation with the Chair of Adult Social Care Committee, to take all steps required to continue the Changing Futures lead delivery partner contract to a maximum of 1.2 million from April 25 to March 26. And finally, point 4 notes that Bristol Multiple Disadvantage Strategy will be overseen by the Health and Wellbeing Board, and the delivery plan will be held by system partners in the Multiple Disadvantage and Transformation Board. I'd just like to remove the report, and if there's a seconder. Thank you. Councillor Weston, thank you. And yeah, if I just ask members if they just vote by hand, just to show that you accept the recommendation, sorry, just show by hand. Thank you, because we're not voting. Thank you very much. We've got a full house. Thank you. Thanks, Bronwyn. Welcome back, Councillor Blake. Okay, so we'll just move into agenda item 8, which is the Keeping Bristol Safe Partnership Annual Report 23 to 24. And just need to advise you that this report is to update, inform and share the safeguarding work of the Keeping Bristol Safe Partnership. There is no decision to be taken on this report, so this is just for noting. So I would like to invite, and do forgive me, Emily, because I have an affliction, right? And I put H's in front of E's, right? So Emily Wren to briefly outline the report. Thank you.
Hi, thank you, Chair. So I wanted to start just by giving an overview of the partnership to raise a bit of awareness for it, because it's quite, not completely unique, but there's less than 10 local authorities in the UK that have adults, children's and communities under one partnership. It's much more common to have adults, children's, communities separately, or adults and children's together and community separately. It's a real strength of ours. If you take something like child criminal exploitation, normally affects children, crime, so it falls under the community safety umbrella, and especially if it's, say, something like county lines, it can be to facilitate adult drug use, or it can have adult perpetrators as well as children. So something like that can be discussed as sort of a cross-cutting and overarching look at the issues within the city, rather than it being sort of square peg round hole into one or other of the three. So that's us. So my role within this is the Business and Partnerships Manager, which helps with the partnership to oversee those three strategies. I do have a PowerPoint, but I didn't send it round in time. That was my mistake. So if anyone does want to see any more, then by all means, please just let me know and I'm happy to share. So as part of one of our statutory obligations, we must report an annual progress report. So this is 23-24 based on the financial year. It does report back into Department of Education, and it is, strictly speaking, a children's arm, but where we have the partnership of all three, like I've mentioned, we also do comment on adults and communities, but with a larger focus on the children's section. So what I've done is just pulled a couple of highlights from adults, children's, communities, and also statutory reviews, and then happy to take any questions on these or any of the report that's been submitted. Do bear in mind this is April 23 to April 24, so some of the stuff may feel somewhat historic. So one of the highlights that got put forward through Adult Social Care was the implementation of their new quality assurance framework. So this was done with a lead from the principal social worker around how to monitor best outcomes and consistency across adult social care practice, notes, and general support of a service user's journey from start through to finish. Something else that happened within the Safeguarding Adult Board was the construction and the sharing of an organisational abuse policy for anybody experiencing abuse within a setting or workplace. And then third was the creation of a data dashboard, which allowed us to be able to track trends, see rises across things such as referrals, waiting times, a wide variety of metrics. It's predominantly focused on adult social care Bristol. We're hoping to bring in more partnership data as the year goes on, but it still gives us a really good base point to make some data-informed decisions. The focus for this year that we're already working on is the implementation of an adult MASH, which stands for a multi-agency safeguarding hub. This pilot is already up and running. In fact, it went live properly on its own this week. It's led by a social worker called Rob Biles, and that hopes to improve waiting times, management of complex cases, and information sharing and joint working, especially at the early stage of a referral into adult social care. Another focus is the reduction of waiting times, which we hope to some degree that the MASH will be able to support with that alongside the quality assurance framework to make sure that referrals are appropriate, that there's enough information to delay any wait for the people we serve. And And then finally, as much as this one does sit with adults, it also overlaps with children's as it's transitional safeguarding. So for when a child becomes the age of 18 or up to 25, depending on additional needs, to make sure that they don't face falling off an edge from children's services into adult services, and they're holistically carried across depending on their need. We run that through a transitional safeguarding subgroup, which is chaired by Duncan Stanway, who is a director at Barnardo's, who supports us. We've already written an updated policy, and there's plenty more work to come for this year. Moving on, I am going to lightly touch on children's and communities. I'm aware I'm sitting in the adults, but it still can link in with overarching themes. So the children's actually launched their MASH last year, and we've taken learning of things that work well or things that were less so into our learning for the adult MASH. There was a rollout of the ICON training, which is support for young parents or professionals who are supporting parents for children when they're crying and how to care for them, with an aim of reducing shaken baby syndrome, to say how you could never shake a baby, it's okay to walk away. This was shared across the whole BNSSG, the Bristol, North Somerset and South Gloucestershire partnership. It was delivered by the ICB alongside the local authorities. Next is the work done with the child sexual abuse pathway, and this was actually a national piece of work with the Centre of Excellence. So Bristol was one of the 10 local authorities who participated in this by creating resources, protocols and practitioner information to share. The report of that has literally come out, I think, a week ago today, on all the work that has been done on a national front. And then we touched on lived experience, but we have a shadow safeguarding board who are a group of young people under the age of 25. So there is that transitional age as well. Some who are care experienced with multiple disadvantages, and they hold our leaders to account. They've been involved with University of Bristol's survey on vaping, which supported 2 PhD projects. They've also been mentioned and supported with the domestic abuse strategy, which is due to be launched at the end of the year, following the changes with law whereby children are now recognised as victims of domestic abuse. They've also been involved in interview panels for several senior positions within the council and will continue to do that. So adults are slightly more ahead with data than the children's arm, so where the focus for children's is to improve that data quality that I've mentioned that's working well within adults. There is a large change around legislation to do with Working Together 2023, which will affect, because we're in the partnership, it will affect children's, adults and communities with sharing agreements and sign-off processes for certain protocols. And then finally, we hope to bring back in Operation Encompass, which is where a police call-out has come to a house from domestic abuse call-outs, and then the school of the children are notified if they would come into contact with them, and we're hoping to relaunch that. Lastly, there's community safety. So during the year in question, one of the highlights was the really strong partnership with the long-standing strategic partnership against hate crime and the work that they have achieved, but also the quick setup of the combating drug partnership. This was mobilised quickly after a spate of fatal overdoses that Bristol experienced in July 2023, which was predominantly caused by synthetic opioids. Another section of lived experience the partnership supports with is the Survivors Forum, which is survivors of domestic abuse. They have helped to review the council's new strategy, the domestic abuse and sexual violence strategy, which I've mentioned, as well as the council's initiative to receive a DAHA accreditation, which is Domestic Abuse Housing Alliance accreditation. They've been supportive of that. So some of the focuses for this year, we hope to create a sustainable preventing radicalisation model. This is following the cessation of Home Office funding in March 2025 to support children and young people along the PREVENT pathway, which is against radicalisation. And also a large change will be within the community safety arm is the recommissioning of Bristol's substance misuse services, which is due to go live at the beginning of April. And next I'll mention statutory reviews. So for those who are not aware, we commissioned 3 different types of statutory reviews. a SAR, a DHR, and a CSPR. So a SAR is a safeguarding adult review where an adult has died under suspect of abuse or been seriously harmed under abuse or suspected neglect, where agencies could have worked better together. So learning from this within the year is this is not a Bristol only specific, it is nationwide, but there's been a clear rise in self-neglect cases. We're hoping that the adult MASH should help to improve some of those, as what we find with self-neglect cases, there can be many agencies involved, and the engagement from the individual cannot be as high with different multiple complex needs, and the MASH will bring the professionals around to see what support can be offered to them. This actually came from a recommendation following a review, so the fact that the MASH is now here is really exciting. Next is domestic homicide reviews, DHRs. So this is when somebody has been killed or alternatively ended their life via suicide, if they've been in an abusive relationship with intimate partner violence, or it can also be abuse within the same household. So the two biggest increases in numbers which we pulled out here is there has been a significant increase in male victims, and there's also been an increase in victims ending their life via suicide. And finally, CSPRs, which is child safeguarding practice reviews. Again, it comes with a similar definition for the two other reviews I've mentioned, but the victims here are children. We are currently running two. They're yet to be published. The rapid reviews have highlighted certain learning across cross-cultural competency and also risks around excluding children from educational settings. So it's a year's worth of work in a short space of time, but I'm happy to take any questions and also share any relevant PowerPoints of people of interest.
Thanks, Emily. I just have before I go over to members, I just wanted to ask you a question about the PREVENT programme. So I know the historical PREVENT programme focus, and I'm wondering if there is a sort of any kind of plan to look at you know, the events that took place in summer, not just in the summer, but when we had left, you know, the right-wing contingent wanting to take over Bristol but failed abysmally. I'm wondering if we're doing any work around young people that may be being drawn into that way of thinking, you know, the negative aspect of it, without, you know, naming anything. But I'm wondering if there's any kind of movement towards making that type of radicalisation part of the PREVENT programme.
Yeah, so the PREVENT programme more specifically works at kind of it's got three arms around preventing people to get sucked in, for use of a better word. Within work completed within the partnership, I mentioned the strategic partnership against hate crime. So they took a lot of that work because it was aimed at certain people and the rates of hate crime, reporting of hate crime went up. That was definitely something that will be in next year's annual report from their sort of response to it, whether that be through communications externally, but also internally within the council. We also ran a session with the Shadow Safeguarding Board around it from a young people's perspective. The strategic partnership against hate crime is all age, but does tend to focus more on adults because you do have certain things like PREVENT, which is more to do with younger people. So we did both, but in two separate places. Thank you.
Thank you very much. Councillor Clark, and then Councillor Weston, and then Councillor Y. Thank you.
Just to really thank you very much for your reporting back, really helpful. Just two things really. One about, this is a truly a multi-agency approach. It cuts across the entirety of the council. I can't think anywhere it doesn't really cut across. And then obviously you're working with voluntary sector, police, agencies across the city and probably beyond. Just wondering how you're coordinating that so nothing drops through the net. And the second question, which is on a similar basis, is how are you ensuring that individuals don't drop through the net because there's so many moving parts within this whole process? Thank you.
Of course. So for the first part of it, I suppose I am not the partnership, so it's wide-reaching in the fact that the Keeping Bristol Safe partnership is more the sort of strategic umbrella in which it sits. Personally, I've only been in the role for 6 months, so it may be a bit of a big question, but one of my goals is improving the lines of communication so that you get a real floor to board and back again. I use a figure 8 kind of motion of communication down and feedback up. That I'm hoping that will get stronger in time. We've brought in different reporting strategies, which we're actually trying within the community safety arm of the partnership, so that we can get each of the subgroups speaking up into the board, which informs the executive, and then executive can make decisions or suggestions for the board and back down. So it's quite methodical, so that in the hope that that will minimise the drop-off of a finer reporting. If that works, hopefully, next year, as in calendar year, we'd bring it into adults arm and children's arm. I don't think it will be foolproof, but I think where you've got it set across the partnership, people will know what to expect, so the reporting should be smoother. But yeah, that's the ideal. And sorry, forgive me, I can't remember the second part of the question, sorry.
That's okay, thank you. The second part of the question was around making sure that individuals don't slip, because you've got so many moving parts, the individuals don't slip through the net.
I suppose with our strategic plan, because we cover so much, there has to be a narrowing down of some element of focus. So, for example, transitions being one of them, that's a focus, self-neglect at the moment. There's specific work streams on those, and just that then brings its own data metrics, it brings its own success measures that we can see that section is working. We also have the escalation and complaints procedure if anything doesn't. So on the worst case scenario, that's why we have the reviews and escalation, to be able to fix if there is anything. But at the moment, those are some of the topics that have got the area of focus to hopefully minimise some of those gaps. When we're happy, that's when the executive or the board will be able to say close down those task and finish groups and be like, actually for now that's working, and it can be reviewed sort of when it's had enough time to really grow legs, so 6 months, a year later, and be like, is this still working? That's through quality audits. Thank you.
Councillor Weston.
Thank you, Chair. Yeah, just got a couple, if that's it. Well, actually 4, but we'll see how we do. The statutory reviews, I find the statistics surprising, welcome, but surprising, because I would imagine it would have been a bit like a pipe, where reviews come in, reviews come out, and how it works. But the initiated 2 for a whole year seems very low, especially when the ongoing figure is 987, so it's a lot higher. So I guess the question is, how come the amount coming in the pipe is so low, but the amount coming out the other end seems to be quite slow? Mm-hmm. I don't know if you could talk a bit about, because I don't understand it as all.
No, that's absolutely fine. And thank you, whoever's doing the slides. Were you particularly talking about the domestic homicide reviews? Is that right?
Oh, well, actually, either one of them is the same.
So one of the things with the domestic homicide reviews, I'll speak about them because they work slightly differently, is that once they've been initiated, written by us, they go through quality assurance and they have to be submitted to the Home Office. So the Home Office delays are around about 1.5 to 2 years from being submitted into the Home Office. So you do reach a kind of stagnation of waiting for those to come through. The SARS don't do that in the same way. However, that does fluctuate. There's all sorts of things such as parallel processes, say with the criminal justice system, which means that we can't publish or progress, for example, or family involvement. If the individual's still alive, it takes a different way around to ensure confidentiality in these things. But predominantly the hold up is with the Home Office for the domestic homicide reviews.
Thank you. For whoever's doing the slide then, I'm looking at the geographic profile of adults at risk, if that's all right. The map was, should we say, a bit strange. You've got it broken down by ward area, essentially, and like any councillor, I immediately look at my ward, because that's what we do. But I'm a bit surprised, welcome, that the adults at risk part of Henbury and Brentry is lower than the adults at risk in Westbury-on-Trim and Hemleys. I would have thought that would have been reversed. Henry Brentry is a poorer area. I would have thought there would have been more adults at risk in that area as opposed to Westbury-on-Leeds, which is actually quite a well-off area. Do you know why there is such a discrepancy in that kind of thing?
I suppose the risk in this particular metric is meant in quite a large sense. So it could be at risk because, I know I've got to try and think of an example.
More care homes in an area automatically?
Yes, so it could be physical health need, which puts an additional vulnerability. It could be whether they have access to certain healthcare. It's not necessarily at risk of harm or abuse. It also doesn't fully discriminate based on finances. So domestic homicide cases can fluctuate massively, and there can be abuse, but different types of, within certain pockets. Financial abuse is more common in affluent areas where there's more finances to play with, for example. So at risk is a very, very general, broad term. Sometimes where you have more care homes, where there's institutions, organisations, the risk of organisational abuse will go up because there's more organisations, as opposed to it meaning anything to do with the care homes themselves, for example. So it's a very loose term of risk in that respect. It's not, neither of the wards you've spoken about are sort of like concerningly high. It can be done with population and population density as well. So there's quite a lot of factors involved in that. So I don't know if that makes it clearer.
Sort of, I think.
Yeah.
All right. And final one from me, Chair, if I may. When it comes to domestic abuse, and I realise again there's a wide gamut of exactly what that entails, is it possible, and this is a bit later date, could we have the breakdown by ward, please?
Of what
Levels
to do
of
with domestic
abuse in each ward. The reason I asked that is I remember attending a meeting about 10 years ago, and Henry Brentry had something like 140 reports of domestic abuse over the course of a year. And I remember Stoke Bishop having 2. Now, the response to that was actually Henry's was high, but at least it was being reported and recorded, whereas Stoke Bishop's actually was abnormally low, which actually indicated even more of a problem because no one was reporting it. And I just wondered if it's possible, as councillors after this, to have a breakdown of how that is. You must have the data from what you've got here, if we could have it on a ward level.
Yes, it was just me checking whether you meant sort of reports to the police, and also to clarify if it's repeat reports. Sometimes if somebody is in an abusive relationship and multiple repeats can then skew data slightly.
Single occurrences, please.
Single occurrences by ward, I can definitely ask.
Thank you. Thank you, Jen. That's it.
Thank you. Councillor White and then Hugh. Thank you.
Thanks, Emily. That's really good. Just on a personal note, I'm involved in running a. Sorry if I jumped in. I've been involved in running a care home charity, and we've always found safeguarding very helpful, I have to say, in response. You did mention waiting times, and that was one thing I had in my head. There's nothing here I picked up about how responsive we are in terms of first kind of how safeguarding teams are in terms of responsiveness. So I was going to ask a bit more detail about that. And also, we could pick it up in the next session, but I wanted to know how much it figures in our CQC assessment as well.
Yes, probably maybe a Hugh
We
or
could do that
a
next
question.
session.
Do you mind if I hand across?
But the waiting times first, because that's probably the waiting bit first.
Yeah, go ahead.
Yes, I'm happy to. Thank you, Councillor White. So, waiting times is something that we're focusing on, and ahead of our CQC inspection, it is something that we are concerned about. We've made very significant progress over the last year to reduce both the numbers of people waiting. I haven't got that data to hand, but I could supply it to you subsequently in terms of the progress that we're making. So both on the numbers of people waiting, but also the length of time that they're waiting for. So our data is improving all of the time. We have also introduced a kind of risk matrix, if you like, that determines and helps us to make risk-based decisions about how we allocate cases and how quickly we work with people based on a risk assessment, basically. So I'm very happy to supply data separately on that, if that would be helpful.
Thank you. Did you have a second part to your question, Councillor Why, or was that was it? Okay. Hugh, do you want Councillor Bates to go first and then you finish off?
Of course, no.
Okay, thank you.
Thank you, Chair. I just wondered, thank you for the report. I just wondered, obviously a lot of the organisational reporting for adults are coming from the healthcare sector. And I'm just wondering how we ensure we're not always getting the same result as we always have. So, for instance, let me give you an example. So, modern slavery seems quite low, and it just feels to me that, you know, potentially we're just getting the kind of, you know, we're getting the things that we have most eyes on. So we've got, you know, obviously in healthcare settings, we've got lots of people out there providing, you know, healthcare services, and they're kind of very much attuned to self-neglect and all those items. And I'm wondering about whether or not those organisations are attuned to some of the things that are more lowly reported in this, and how do we ensure that we have absolute oversight and understanding of the things that are reported a bit lower down in terms of the numbers. So that's my first question. I've got a second question about governance. But
to use modern slavery as an example, so within the community safety arm of the partnership, they have subgroups around smaller, more niche tasks. So, for instance, the adult social care one has self-neglect. The community safety arm holds a modern day slavery, the hate crime, so something a little bit nicher. So work is still being done about it. We do offer it as part of our multi-agency training package. So it is always available for people if they aren't sure, if there is something going on. I suppose rises in data or decreases in data, that reporting I mentioned to kind of go into the community safety partnership, where we have the executive, if it's being brought up as a concern, either it's gone down particularly or up particularly, we then look at that across the whole partnership. Is it affecting predominantly adults? How is that affecting children's services, etc., and can have that more of a strategic oversight from there. It's tricky to do. Some of the abuse types that we're mentioning are more hidden, but with work completed around the subgroups that we're doing and always having it as a training option, it never falls off the radar of the safeguarding arms.
Thanks. And then the other thing is about governance. We looked at your sort of organisational chart, and it's pretty complex, right? This structure. And I'm just wondering where sort of politicians have a role to play in this sort of accountability. If it's not so much the operational element of the structure, because obviously, you know, politicians do have a role in allocation of resources here. And so I'm wondering what the sort of governance model and how does it take account of the political kind of environment. And that's probably a question for you more than it is for yourself, but ensuring that there's some element of oversight in this in the work we're doing in partnership.
Yes, I think probably the first thing I'd want to say is that we're in the process of it, as I know you've noted, in the process of a bit of a rethink, because for a couple of reasons. First, I'm very grateful, Emily, for you coming today. Actually, to be fair, we've got new leadership. We've got a new chair of the safeguarding Keeping Bristol Safe Partnership, and you know, you're new-ish, really, aren't you? And a lot of your colleagues are. So we've got a new team heading it up, and so we're working through, because I think, with the best will in the world, the original, you know, how the Keeping Bristol Safe Partnership was developed over the COVID period. It started just before. It never had a chance to get its legs because COVID happened, and so it didn't develop in the way that I think it was originally intended. So now is a real opportunity to develop that. In regard to the political leadership, certainly we want to find a way to, you know, to weave it in consistently. Over COVID, we did used to have lead members attending briefing sessions with regularity, and we would be looking to create something that reflects the plurality of the committee system, but also allows lead members with a particular interest in safeguarding to have their involvement, because it is really essential that, you know, it's a statutory responsibility for the council, it's a statutory responsibility for me as the exec lead, but also for Lorraine in the role as the statutory elected lead, and it's something that we as a council are choosing to do in a plural way. So yes, the answer is yes, but we are in the process of working out the new ways of doing things, and we'll be watching this space sort of thing.
Thank you, Hugh.
Did you have anything further to say, Emily?
No.
Okay. Any more questions before we round up? Okay, just making sure. Okay, so. Oh, sorry. Did you? No. Oh. Yeah.
No, I mean, I did in part of the wind-up. I was just going to thank Emily, and I've done that already, but I'll reiterate that. And as I say, this is a new era for our Keeping Bristol Safe partnership. This is an excellent report, which I commend to you, and I hope you all get benefit from reading it. And, you know, safeguarding is everyone's business. It's one of our key functions, and I'm hoping that everybody takes an active role as lead members, but also as, you know, councillors and citizens, really. So thank you.
Fabulous. Okay, I'd like to thank everybody for their questions. So I'd like just basically to us to note that the Keeping Bristol Safe Partnership Annual Report in its relationship to safeguarding adults as well as children and community safety, that we need to remove the report. So I'd ask for a seconder. Thank you, Councillor Blake. And would like to ask the committee all just to vote by raising your hand. Any objections to the report? Fabulous. I'll take that as a 4. Thank you very much. Okay, so it has just gone 3 o'clock. We have a quick 5-minute break. Please, if you do not stand up, you can just wiggle around and be back here dead on 7 minutes past 3. Have a wiggle, have a stretch. Okay, I would like us to convene. Again, it's 7 minutes past the hour. So we're just going to move into item number 9, which is the P6 Finance Outrun Reports. Okay, so I just need to tell the committee that this report presents a brief update to the Adult Social Care Committee on the Council's financial performance against that approved budget and its forecast use of resources for the financial year 24 to 25 September periods. I'm not sure what that means. Okay, 24 to 25. There are no decisions to be taken on this report, which is for noting. And I just need to sort of tell you why we're doing P5 and not P6. So you may also wish, Adult Social Care Policy Committee received the P5 finance report at the last meeting. The monthly finance reports have been exception reports, i.e. only provided if there is a material change to the forecast for a budget within the remit of the committee. That has not been the case since period 5, so the circulated paper is a short covering report rather than the full breakdown. I'd like to invite...
Chair, can I just interrupt ever so quickly? The title of the report is P6.
It is P6.
It's...
Yeah, no.
Okay.
Sorry, I shouldn't.
It is P6, but it's not updated. So it's still P6, but it's not been updated since P5.
I think what she said was you got the full report in P5. That's what Councillor Francis said. You got the full report in P5. This is the P6 cover report, but it's not a full report like P5 because there hasn't been material changes in between.
Yeah, I think that's what I said, I think. Okay. Does that make sense? Councillor Weston, you've got a question? I do. Okay, when you get there. Okay, no problem. Right, so I did say that. I might not have... I did say that, what Hugh just said, but maybe it wasn't clear enough, but don't worry. Okay, so I'd like to invite Hugh Heavens to introduce and outline the report, and he can reiterate the report so that it's absolutely clear. Okay, thank you.
Yeah, there isn't a huge amount to update in regard to this. What we see in this period is an increase in the projected overspend on the adult social care budget of just under £1 million, which then translates into a forecast overspend of 7.5 million on the net budget of just shy of 198.8. So that is 3.8% of the net budget. Now, of course, that is an awful lot of money. And it's something that we are working very hard through transformation work to address. And I think that we can show some progress on that in period 7. You'll get a subsequent report in regard to period 7. And I anticipate that period 7 onwards will be showing improvements upon that. But the work that we've outlined in prior meetings in regard to our transformation programme, in regard to spend control and cost mitigation, looking at our commissioning, maximising accommodation with support options, optimising our care provision and improving our systems and processes are making a difference to that. It is a bit unfortunate that we report at these committees a month or two after the event, although by definition that is bound to happen because it takes a few weeks to pull the papers together for these committees. But the long and short is, whilst yes, just shy of £1 million is a huge amount of money, for the size of the budget, that's a relatively stable position, and I'm looking forward to coming to you in the new year with reports showing improvement.
So, I think the first person with a question was Councillor Weston, followed by Councillor Clark. Anybody else with any questions? Okay, go ahead. Thank you. And Councillor Beck.
Thank you, Chair. In some ways, Hugh has actually sort of answered the first part of the question. And I guess I just want to drill into this capital programme on this one there's been no material change. So I would expect then nothing's been spent on the capital programme, otherwise we'd have an updated figure. How come we've spent nothing on the capital programme and we're now halfway through the year?
We have got a significant amount of development work underway that is capital orientated, but the way that we, because of our approach to specialised supported accommodation, the means by which we're developing, it doesn't always draw on council capital in order to deliver. So the work that we've had underway for capital developments tends to be more around enabling other organisations like Bristol's registered providers to borrow on the strength of our commitment to use the resources that they develop, use the facilities that they develop. So, for example, the Oldland Common development, that's 6 units of specialised supported accommodation for 6 people that are going to be moving back to Bristol in the new year for the first time after being in accommodation outside of area for a good period of time. That has all been with partner organisation Elim Housing. That's all been without Bristol having to use any capital. You'll see our capital commitment is really, really low. I mean, we've got a couple of million in there. There are some schemes that we will be using it for, but by definition, and they are also specialised supported accommodation, but by definition, they're long-term developments and they take potentially longer than a year to deliver against. But compared to other departments, other directorates, capital allocations of tens and hundreds of millions, it really is only a small amount because we tend to do our developments more in partnership and enable others to borrow rather than to borrow ourselves.
And final question, Chair. I know you're going to bring us back in period 7, a more comprehensive breakdown so we can see the gap closing. Do you envisage the gap closed at the end of the year?
I'm an ambitious person, Councillor Weston, and I...
There's a press right
yes,
there.
I know, and I'm painfully aware of that. No, we are working very hard to close the gap towards the end of the year, and it would be foolish of me to suggest one way or the other any predictions because we're in the middle of winter. There's all manner of pressures incumbent upon social services departments up and down the country. You know, one very difficult cold period, you know, 1 or 2 problems with providers, perhaps a seasonal flu outbreak could thwart all of our best laid plans. But we are working to address our shortfall, and we intend to do so.
Councillor Clark.
Thank you very much. I love it, the fact you say it's only 3.8% over budget, which is 7.5 million, which is a significant amount of money, and we're still going in the wrong direction. I mean, obviously, we want to seek assurance that you're going to stem the tide, and we are going to start clawing back that overspend. I mean, I know that Councillor Weston has held your feet to the fire, and you said we're going to have a balanced budget by the end. I think I heard you say that, but no, I didn't think I did actually.
You feel you want to prolong my my foot fire exposure a little bit more, which is your right and your duty as a lead member. We are working, we're pulling the stops out and working very hard to address the financial challenges that face us. We have brought our budget in on balance 2 years in a row, last year and the year before. This year poses significant challenges on top of those that we've experienced in prior years, and next year poses huge challenges, as we've seen in our Strategy and Resources Committee discussions that we've had in recent months. The work is underway, and as I say, period 7 showing very, I'll say tentatively showing some green shoots. So there's a lot that can happen between now and the end of the financial year, but I am I'm confident that we have the right things in place to make a difference.
Thank you. Just a follow-up question, and I don't wish to be political, but
But you're going to.
yeah, I apologise in advance. Is there any modelling to show what the reduction in the winter fuel allowance eligibility, how that's going to have a knock-on effect with adult social care? Has there been any modelling on that yet?
I'm not aware of that, no.
Because that could have serious implications for adult social care.
Potentially. I'm not aware of any modelling. Yeah, I mean, as far as I'm concerned, the people most in need, the people who are most financially in need, can source similar levels of resource in other ways. So, as it stands, I'm not aware of any particular implications that might occur solely as a product of that.
Okay, thank you.
Perhaps we're used to saying modelling to assess how much adult social care budgets have gone down with the coalition government we had. Putting that to one side, I think I don't want to get ahead of ourselves in terms of the budgetary process. There's significant demand in services, which I can, give us your assessment about where that demand is going to go for the last few months of the year. But before, and my final question would be, can you give us a flavour of the process by which we're doing the work to determine the budget for next year? I mean, I see it from I'm on the finance committee, so I know what that process is, but I don't know if every member of the committee understand that process.
Right. In regard to demand, demand is, as ever, unpredictable, although we do see an inexorable rise. Winter demand is obviously, as you'll know, from NHS involvement, it fluctuates a lot, and it's not seasonal. It's not necessarily to do with weather. You can have winter demand in the summer sometimes in regard to pressures upon the system. What we have put in place in regard to demand that comes from the acute and urgent emergency care part of the system is we've got much more robust processes and staffing in place at the back end of the acute hospitals in order to support discharge flow. So actually, where a couple of years ago we were seeing bulges in demand that were challenging, at this stage now, whilst demand is high, we've got a much more regular feed through, and we are able to manage it more effectively. So that's transfer of care hubs and things like that we see at the back end of the hospital. In regard to younger adults and people
participation. The next meeting of the Adult Social Care Policy Committee is Monday, the 27th of January, and we will be in 2025. So thank you all very much. Thanks. if we just have does members want a 10-minute break, 5-minute break, and then we'll go in? Because we're
Is it in another? It's in Hanover, isn't it? Yeah, yeah.
Yeah.
All right, okay.
Yeah.
Thanks. Yeah.
10 minutes, and then that'll give us chance to get there. Yeah. Thank you.